Have you had a C-section before and you want to have a vaginal delivery? I'm Dr. Blackett, an OBGYN with Yada Yada, and today I'm talking about 7 things you need to know before you have a VBAC, a vaginal birth after a C-section. So why would anyone want to have a VBAC? There are many reasons. A shorter hospital stay, less of a recovery, less of a chance of infection, less bleeding, a little bit cheaper. Maybe you want to have 10 kids. That's a little easier to do if you have vaginal deliveries. What are the risks of having a VBAC? Well, the big thing that we worry about is something called a uterine rupture. It's rare, less than 1%, but it can be life-threatening. So it is something to be aware of. So who can have a VBAC? It really depends on the type of scar that you've had on your uterus. So not the scar on your skin, but actually on your uterus. That scar needs to usually be a transverse or low transverse scar, as opposed to a classical or vertical scar. It's also important to know what the reason was for your last C-section. If you had a 10-pound baby that didn't fit in your pelvis, there is a good chance that you may have a fit issue again when attempting a vaginal birth. But if your C-section was for something like fetal distress or breech, something positional, that might be completely different the next time around, so you have a higher chance of success. A 2013 study showed that 70% of patients who attempted VBACs were successful if they had one prior C-section. Who can't have a VBAC? Well, if you've had a prior uterine rupture, you're out. You can't have one. If you've had a classical incision on your uterus, which as we mentioned is a vertical incision, then you can't have one. If you've had other surgeries on your uterus that might have made a weak spot anywhere else on the uterus, then you can't have one. Now, those are the people that really should not have vaginal births after C-sections, but there are some that are in a little bit of a gray area. For example, people who have more than one baby, people who have gained more than 40 pounds in their pregnancy or are obese, people who have had a shorter interval between pregnancies. It's been less than 18 months since their last baby. Babies who are in an abnormal fetal position, or if you've had 2 prior C-sections. Now, that's not always the case. There are some situations where patients have had 2 prior C-sections where it may be safe to have a VBAC, and that you'll want to talk with your individual provider about. For example, this is hypothetical. I had a patient who'd had some vaginal births, and then a C-section, and then a VBAC, and then another C-section. She would be a good candidate for having another VBAC again because she's successfully VBAC'd before and she's successfully had vaginal deliveries before. But there are a lot of factors at stake, so definitely talk to your provider about that. Where can I deliver to have a VBAC? You'll want to check with the hospital that you're planning to deliver at because not every hospital is equipped for an emergency delivery. In order to have a VBAC, hospitals have to have in-house anesthesia and an in-house OB provider that will be there for the entire time that you'll be laboring in the event that there is an emergency. And some hospitals just don't have that capability. Can I be induced if I'm having a VBAC? Well, they've shown that you do have decreased likelihood of success if you are induced. But it really depends on what your body is doing. We try with VBACs to not give you a lot of that medicine that makes you contract. It's always better if your body's doing it on your own. But if your cervix is favorable, meaning it's dilated and it's soft, and if you successfully VBAC'd before, then that's a conversation you'll have to have with your OB because they may feel very comfortable inducing you. Sometimes all it takes is breaking your water and your contractions may start up on their own, or they can give you maybe a little low-dose Pitocin. But if your cervix is really not doing anything and it's firm and you're not dilated, then it would not be safe to induce you. How will labor be different when having a VBAC? During some labors, we can do what we call continuous monitoring versus intermittent monitoring. Continuous monitoring is when we leave the monitors on for the entire labor to see what's happening with the baby and to assess the tone of the uterus. In a VBAC, that's very important. You would not likely be able to have intermittent monitoring where those monitors come off for certain periods of time during your labor. As mentioned previously, you'd have in-house anesthesia and OB coverage, and it's really recommended that you have an epidural in the event of an emergency delivery so that you don't have to be put to sleep. So people ask me, Dr. Blackett, what would you do? Would you have a VBAC? Well, I actually know from experience. I had a vaginal delivery with my first baby, and my second decided to be completely stubborn and was breech. So when I went into labor with him, I had to have a C-section. When my third pregnancy came around, I thought about it. My C-section really wasn't terrible. My vaginal delivery really wasn't terrible. So I based my decision more on what my body was doing near the end of my pregnancy. You'll be having exams with your provider to assess if your cervix is dilating, if it's thinning or effacing, if it's getting ready for labor. And I thought, if my cervix is showing signs of readiness, then I think I'll go for a VBAC. If it's closed and it's tight and it's not thinning, then I was planning on having another C-section. And I went into labor on my own, so I was able to have a successful VBAC. But everyone's experience is a little different, and you may have factors that affect your success and your ability to have a VBAC. So just discuss it with your provider, and I'm sure they'll be able to answer all your questions.